Now we'll move on to look at the muscles that produce movement at the joints of the ankle region. In doing this, we'll meet most, but not all, of the muscles that are in the leg. There are 4 muscles that are in the leg, which we'll leave out of the picture till the next section. These are the long flexors and the long extensors of the toes. Along with the muscles, we'll meet the various layers of deep fascia which divide the muscles of the leg into rather distinct compartments. We'll start with the muscles that produce dorsiflexion and plantarflexion at the ankle joint. Next, we'll look at the fascial layers and compartments. Lastly, we'll look at the muscles of inversion and eversion. First then, the dorsiflexors and plantarflexors. Dorsiflexion involves just lifting the foot. Plantarflexion involves lifting the whole body. So it's not surprising that the muscles for plantarflexion are much larger than the ones for dorsiflexion. There's one muscle on the front of the leg for dorsiflexion, tibialis anterior. There are 3 on the back of the leg for plantarflexion, gastrocnemius, soleus, and plantaris. Here's tibialis anterior. Tibialis anterior arises from the lateral surface of the upper tibia and from the interosseous membrane. The tendon of tibialis anterior passes under the extensor retinaculum and winds around the medial side of the tarsus to insert right down here on the first cuneiform bone and on the base of the first metatarsal. The main action of tibialis anterior is to produce dorsiflexion at the ankle. Dorsiflexion is not the only action of tibialis anterior. It also has a role in producing inversion, as we'll see shortly. What's more, tibialis anterior is not the only muscle that produces dorsiflexion. It's assisted in that by the long extensor muscles for the toes, which we'll see in the next section. We'll move on now to look at the muscles that produce plantarflexion. 2 large muscles, gastrocnemius and soleus, and 1 small muscle, plantaris, join together to form the massive calcaneal tendon. Here's gastrocnemius. Here, deep to it, is soleus. Gastrocnemius has 2 heads, a medial and a lateral. These arise, as we've seen, from the medial and lateral condyles of the femur. The 2 heads of gastrocnemius unite, forming a flat tendon. The gastrocnemius tendon, in turn, unites with the tendon of soleus to form the calcaneal tendon. To look at soleus, we'll remove gastrocnemius. Here's the whole of soleus. Here's its medial border. Here's its lateral border. Here's the cut edge of the gastrocnemius tendon. Soleus arises from the medial edge of the tibia, from this oblique line on the back of the tibia, and from this area on the back of the fibula. Between the fibula and the tibial origins of soleus, there's an arch of fibrous tissue. The popliteal vessels and the tibial nerve pass beneath this arch. Here are their divided ends. For completeness, we'll add plantaris to the picture. Here it is. Plantaris arises here, on the lateral epicondyle of the femur. The long tendon of plantaris runs almost to the ankle before uniting with the calcaneal tendon. The calcaneal tendon is also known as the Achilles tendon, or simply the heel cord. It inserts into a broad area here, on the back of the calcaneus. In front of the calcaneal tendon, there's a pad of fat, which fills the gap between the tendon and the back of the ankle joint. The action of soleus, gastrocnemius, and plantaris is to produce plantarflexion at the ankle joint. Their action lifts us up off the ground when we stand on tiptoe. When balanced against gravity, the same action controls our rate of descent. In addition, these muscles provide an important part of the propulsive force in normal walking, in going uphill, in running, and in jumping. Now that we've seen these fascial structures, let's get back to the muscles, the ones that produce inversion and eversion. There are two muscles that produce inversion, tibialis anterior, which we've seen already, and tibialis posterior. Here's tibialis posterior. Tibialis posterior arises from the back of the tibia, the back of the fibula, and from the interosseous membrane in between. Its tendon passes immediately behind the medial malleolus through a fibrous tunnel that's covered by the flexor retinaculum. Beyond the malleolus, the tendon of tibialis posterior fans out. It has a wide insertion here on the navicular and first cuneiform bones, and also under here on the bases of the second, third, and fourth metatarsals. Here's the action of tibialis posterior. It inverts the foot. The other muscle that can act as a foot inverter is tibialis anterior, which inserts so close to tibialis posterior that it has almost the same line of action. We looked at tibialis anterior in its role as an ankle dorsiflexor earlier in this section. Now we'll move on to look at three muscles that evert the ankle: peroneus longus, brevis, and tertius. Here's peroneus brevis. Peroneus brevis arises from here on the distal fibula. Lying on top of peroneus brevis is peroneus longus. Peroneus longus arises from here on the proximal fibula. Its origin extends up onto the head of the fibula with a gap here. The deep peroneal nerve passes under the upper end of peroneus longus here, as we'll see. The other muscle in the picture here is tibialis anterior. At the ankle, the tendons of peroneus longus and brevis pass behind the lateral malleolus and beneath the peroneal retinaculum, longus behind, brevis in front. Peroneus brevis runs forward to insert here on the base of the fifth metatarsal. To see the remarkable course of the peroneus longus tendon, we have to remove the entire sole of the foot. Peroneus longus runs around the cuboid bone and along a deeply placed fibrous tunnel to insert right over here on the base of the first metatarsal. Lastly, in front of peroneus brevis and longus, here's peroneus tertius. Peroneus tertius arises from here on the fibula. The tendon of peroneus tertius passes under the extensor retinaculum and in front of the lateral malleolus to insert here on the base of the fifth metatarsal, next to peroneus brevis. The action of all three of the peroneal muscles is to evert the foot. In addition, peroneus tertius, acting along with its anterior neighbors, can help to dorsiflex the ankle. The muscles of inversion and eversion are important because they enable us to stay balanced and upright on a surface that tilts to one side or to the other.